Well, as you well know, COVID-19 infections are dramatically increasing, but the vaccination rate is doing the total opposite. It's actually decreased dramatically. Let's discuss this and more with Deputy Health Minister, Dr. Sibongiseni Dhlomo. Thanks for your time, Deputy Minister. We appreciate it. It's very worrying today that we're hearing that even fewer people are going to get vaccinated despite the new variant that we're experiencing and despite the high infection rate.
Good evening, and good evening to your viewers. We continue to request people that we must work together, as Minister was calling this morning when we had a media briefing, that we have enough jabs. We really want to get people to make use of the jabs. He was even making a slogan saying, please, jabs before jaw, jabs before a jive, meaning that we are willing, and the government is probably going to support people enjoying their holidays, but in a very responsible way. Why don't you go via a vaccination site and get vaccinated and make sure that you are vaccinated with your loved ones? Because in that way, you know, Mr. Robinson, there is about 75% or more of people who are admitted are unvaccinated. So you will still get COVID even if you are vaccinated, but it will not be a severe COVID infection. It will not send you to the ICU. It will not really make you die. So that is the reason why we're encouraging South Africans to vaccinate, because that is what scientists are advising us to do. Of course, still adhering to the non-pharmaceuticals, avoiding crowds, maybe beach goers, to make sure we are not too many packed in one space, sanitize, and also wear a mask. I'm just here in Durban seeing some of the people wearing masks, but another significant number of people just not wearing the mask. And that is not good for us.
Yeah. So, Deputy Minister, there's been so many campaigns, right, where government has made it really easy. You've taken the vaccines to people. You've taken it to, voting stations. It's now going to be on national roads where you can actually get your jab while going on holiday. It's been made pretty easy, but it's still not working. So you're not able to actually change the sentiment of those people who don't want to get vaccinated. How problematic is that for you?
It is problematic. Actually, we are actually calling upon our South Africans to heed the call. We are actually saying to them, this is something that is going to save our country. We don't want to get back to the economy slowing down, closed down. We would want South Africans to continue the way they've been doing. And if we could actually make sure we vaccinate, if we can make sure, even if we are going to be opening up in the beaches and the South Africans are there ready to take their jabs, that's going to be actually extremely welcomed. So we are going to try everything humanly possible, falling short of making it mandatory, which is probably a discussion point out there. We are for now not calling in for that, but we are saying, can we be responsible and do that possible and do that very well?
Yeah, so let's talk about that, right? The president did mention in his last address that there was going to be a task team set up to look at mandatory vaccines. Where are we in that process and those discussions?
There's still a negotiation process. The deputy president and the president did mention we are not going to enforce it to South Africans. He's consulting. There's a traditional leadership out there to be consulted. There are faith-based healers to be consulted. Faith-based organizations. What we are saying is that if you are in your church, I'm saying you would want to maybe have 2,000, 1,000 people coming to worship, please indicate that all of them are vaccinated. And there's a way maybe we are going to go forward in this country. You want to come into the stadium, you want to come in to enjoy music festivals in a particular closed environment, then there must be indication that we are vaccinated. We already are seeing the enforcement done by other people other than government. Private companies, private enterprises are saying, I would want all my employees to be vaccinated. Otherwise, I'm not going to allow those few. Sometimes it is going to be an issue of, can we go with a collective, what you can call a collective over an individual? Can you really be able to say there's a collective right over an individual right in this instance? So maybe we'll go that route, but we are not yet there. For now, we are still encouraging South Africans falling short of that mandatory vaccines, which has not been finalized or discussed. And we are, like I was encouraging the HODs of these provinces in the Eastern, where we have Eastern Cape, KwaZulu-Natal, Western Cape, Northern Cape, to say maybe we should already, because those are areas where holiday makers go to the beach, also maybe having pop-up sites for vaccinations in the beach fronts, and really request South Africans to come up there, especially there's a lot of young people going in there. Please vaccinate, so that even if you are admitted, right now we have information that people who are getting admitted, they stay 3 days in hospitals and then they are out. Some of them are in there not because of COVID. They were just because everybody routinely now is being screened. They came in there either for toothache, the pain in the leg and the backache. And therefore, when we screen them, we find that they actually have got COVID positive. And then they actually, and some of them, the few that have passed on, the doctors were telling us, are not really out of COVID, but some other complications of other diseases that were coming in there for. So really, while we are seeing increasing numbers of COVID infections in the country, we are still very fortunate that we are not seeing a significant number of deaths, a lot of severe infections wanting to be in the ICUs and getting oxygen, right? So we are really still hoping, as we have seen the Gauteng province with the infections that are high, but not very serious admissions in ICU, that maybe the same will take place in the other provinces that have just started having the very strong fourth wave in them.
Yeah. And do you believe that those who are vaccinated are obviously more protected than those who are unvaccinated, and that's why we're seeing people actually go to hospital but not seriously ill to a point where they have to be put on ventilators, etc.?
Mr. Ramkisson, science is telling us that if we are vaccinated, because look, I always make it very simple. This variant, whether in Omicron or an older variant, it's a brother, sister. It's related to the current COVID-19. So there are remnants of the previous of the virus that you still find on the new variant. Therefore, if you are vaccinated, there may as well be some few areas there where there may be immune escape of this variant, but to a very significant, in fact, 70% of the people who are actually vaccinated are protected against this. That's what they are saying. So there is protection up to about 70% of the population that is vaccinated, as opposed to unvaccinated people. That is our hope, and therefore that is why we insist and plead with our South Africans, go out there and vaccinate if there is still that much of a protection, as opposed to unvaccinated people who are complicating, who go to serious infections and severe disease, ICU, and probably some of the deaths.
What's our vaccine targets looking like? Are we going to reach any of the goals set?
We are sitting at 45% of what of the population, the adult population that is we wanted to be vaccinated. But our interest is actually, if you segregate the population, the 60 years and above are vaccinated up to 66%, which is very remarkable. And the 50 years and above are vaccinated up to 61%. It is this lower age group that have not really pushed very hard. So we are relatively safe to some extent as a country, because it is the older population that usually gets this disease complicating to them. So if we have got 50 and above vaccinated up to 61%, that's really giving us a lot of hope, as we see that, yes, there is increasing infections in the country. Yes, there are admissions that are coming in, but they are not going to the ICU, and we are not seeing a significant number of deaths as of this new variant. But maybe still early days. We'll keep on watching weekly and update the country. All we are saying, can we go there and enjoy the festive season in a very responsible way, adhere to the non-pharmaceutical protocols, please, especially the young people who are going to be filling up the beaches and visiting the other festivities. We would wish that they will adhere to those protocols so that we can save our country and not go back to closing our economy again.
Yeah, just for clarity, you said 45% of the adult population vaccinated. Is that a single dose or double? Fully vaccinated or not?
I think 41 is fully vaccinated. 45 is a single dose, yeah.
Okay, just lastly, there's some concern about the efficacy of the Johnson & Johnson vaccine when it comes to actually getting infected with the Omicron variant, especially from healthcare workers. Are you looking to adjust this at all going forward?
Adjust it how?
To Pfizer, perhaps?
I'm not sure. For now, we are actually getting the second boost. We're getting a booster for our healthcare workers. It's finishing today. We will still be actually advised as to what do we do with the population of South Africa that took the Johnson & Johnson. It's continued to be monitored. No information as yet that says to us that the Johnson & Johnson is completely not actually helpful. Yes, there has been studies done, and there's a report released by Discovery Health talking about Pfizer. So I think then there's no report as yet released by about Johnson & Johnson that it is completely not helpful. Until and unless we get that report, then we can be able to comment. But for now, it will probably be meaningful that we get the booster Johnson & Johnson taken by the other population. Otherwise, if we are given another information, then the booster maybe will be Pfizer for the rest of the country. But for now, we are actually working very closely, the minister, with the Ministerial Advisory Committee that keeps on advising him what's the best way going forward. This is a new disease to everybody else, so we do not have answers to all of these issues. We get to be advised by scientists, and they're continuously engaging them to help us to understand the cause of the disease.
All right, let's talk about the eNCC. You're meeting next week again. Is there any possibility, depending on our infection rate, is there a possibility that you could adjust lockdown restrictions into the new year?
Mr. Ramkisson, we're trying our luck. That's a decision to be taken by the eNCC. Of course, they will be getting the report from the Minister of Health, together with the reports that are going to come in. Like today with the briefing, the minister is saying, what I have today is what I give you. What I will have on next week, Tuesday, giving the eNCC will what I have now, together with what the scientists are going to advise me in the next few days. So it will be a difficult one to tell. But part of what we're actually talking about, as I'm saying to you now, is what will be tabled there with the additional of new information that the minister is going to continue getting today, tomorrow, up to Monday afternoon. Then it will be tabled on Tuesday. However, I want to say to you, we are working hard to make sure that we have this festive season differently than the one we had last year. It depends on all of us cooperating and working together to make sure we adhere to non-pharmaceutical protocols, to those non-pharmaceutical protocols, and again, responding to vaccination, because we now have that is what the president said last time he addressed the nation, to say there was a reason to have lockdowns. We did not have a vaccination. And right now we are calling upon South Africans to vaccinate, because scientists are telling us that if you are vaccinated, you are less likely to have a severe disease. So that call still stands until we have a different view. That is what we are urging us to do. That is the reason why we may actually find that the eNCC considers your point favorably, depending on what South Africans are doing. Are we working together to try and actually keep high levels of vaccination or not? Then that is in our hands, not just the minister or the government to decide on that part.
Yeah, absolutely. Thank you so much for your time. Really do appreciate it. That was Deputy Health Minister Dr. Sibongiseni Dhlomo.